So we're here continuing to speak about the idea of hand postures. We've talked about the broad hand for multi-point discrimination and the idea of molding. We talked about the idea that with the broad hand we want the fingers to be together and the thumb to be in. What we are able to do under certain circumstances is essentially splay the hand out, right? So create a spread of the fingers in order to pick up information we're interested in. Now the place that this seems to be the most useful is at palpating intercostal spaces specifically, or ribs specifically, because we have an interval. Now with the ribs, what we're looking at is bony structures covered in many muscles. However, there is a palpable difference between a hard tissue and a soft tissue. And then we also have the reality of soft tissues that live between the ribs in the intercostal muscles. We're not going to necessarily be able to accurately peel apart layers, but what we can do is we can compare one space to another, right? So this, depending on the size of my hand, depending on my patient, depending on the angle that my fingers are able to take, and depending on the angle of their ribs, I may get accurate readings or I may get inaccurate readings. What I am able to do though, at least in the case of this patient, now this pinky isn't going to give me much. I can't get it into a position where I can exert pressure to give me good feedback. This finger essentially just feels like high pressure. What I can do here, I'm in between two ribs, so I've got a rib above and a rib below. I've got a rib above and a rib below, and a rib above and a rib below. I can compare the intercostal spaces. I can have my patient take a deep breath, and I can follow those. Right? Now when I say follow, what I mean is allow the structures to move my hand. Not move my hand myself, but allow the structures to move my hand when they move themselves. I can at that point begin to pay attention with either vision or with palpation, or both preferably, to see if there's one of those ribs that is moving unevenly. Recognizing that the ribs up higher, in a comparative sense, because they are a different shape and a different length and a different angle, they should move less than the ribs at the bottom. The ribs at the bottom should have greater excursion, so I expect that. So just because this rib doesn't move as far as this rib, or realistically these two ribs and their intercostal space don't move as far as the intercostal space here or the intercostal space here, it doesn't mean that I have a finding. It just means that I expect this to move less than I expect this to move. But I can push into the tissues and try to identify, again, the idea of having the spread out hand is so that I can identify multiple pieces of a similar structure or multiple areas that have similar characteristics in this case intercostal spaces, to compare them against one another. Also recognizing that this handhold doesn't necessarily allow me to feel the whole intercostal space. I may need to palpate around. I may need to actively check here, actively follow, and check further forward, further backwards. Then recognizing that as I come around the back of the body, it may be more ideal for me to have a patient in a different position to expose the anatomy better, but it may also be to my benefit to recognize that the intercostal spaces as you come around the back of the body don't tend to be as broad. But we're talking about the splayed out hand. Now why are we talking about the splayed out hand or the open hand or the spread fingers as opposed to the broad hand? Again, because we're thinking about intercostal spaces, so we're thinking about a structure or a space that is separated by bones, right? So we have, again, a rib above and a rib below, a rib above, a rib below. So we're looking at the soft tissue in between these spaces. I don't necessarily need to touch all of them, because if I touch both the bones and the intercostal spaces at the same time with the broad hand, what I'm going to get is a very mixed signal. If I'm concerned about the intercostal muscles, I would want to touch them and actively essentially create a separation in what I'm sensing. I'm concerned about the soft tissues. I'm not concerned about the hard tissues. Now, in saying that, on the superior border, or sorry, this border, I feel a rib above. On this border, I feel a rib below. Underneath the finger, I feel the intercostal muscle. Same here, same here. In some situations, I may be able to join my thumb, I may be able to get my thumb into an intercostal space. But the big idea is, in most cases, I should be able to get at least 3 fingers playing together so that I can compare 3 intercostal spaces, which really means I can compare the space or the motion of 1, 2, 3, 4 ribs at the same time, right? So again, rib above, rib below, rib above, rib below. So I can get information about 4 ribs and 3 intercostal spaces, because what I've done is I've matched them with my hand posture. This spread out hand does not tend to be good for much else than an intercostal space because there's lots of missing information. In most cases, it's better to have the broad hand, but in the case of checking intercostal spaces, it seems to be advantageous to spread the fingers apart, get them to match. It also seems to be best and most appropriate in the mid-axillary line. It does not seem to work well when the patient is in prone, because again, the intercostal spaces tend to get tighter, and it doesn't tend to work well in supine, partially because of the angle and partially because if you're working on the anterior portion of the chest wall, you have to be quite careful, regardless of who the patient is, whether they're male, female, or other, that this area tends to be sensitive in most patients. So the mid-axillary line seems to be the best place to deploy a hand with spread out fingers on purpose. You can do it in other places, but this is where it's good, on purpose, for a specified reason.